The next year, he went to the same symposium and presented these results. And this guy won the Nobel Prize for medicine. But my point is that, when people go against the grain of medicine that's been established, the medical establishment tries to do whatever they can to knock them down, because now they're things are at risk for them.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk, where we feature the top medical practitioners in health and beauty, both inside and out. I have Dr. Daria Majzoubi, an acclaimed family physician in California who has helped hundreds of patients with his groundbreaking stem cell therapies to treat various chronic conditions, such as lupus, MS, various forms of arthritis, and autoimmune diseases. He has also helped many patients who have suffered from dementia, chronic back pain, asthma, and tendon injuries, and even autism, using their own stem cells harvested from their own bodies. He has done this since 2016 and is the only South Valley doctor who performs these procedures, with patients traveling from all over California to get his treatments. He's co-authored the book, Blueprints in Family Medicine, in 2002, and has been in practice for the past 20 years. So Dr. Majzoubi, welcome and glad to have you here.
Thank you.
So let's dive right into it. How did you get interested in medicine, and specifically stem cell medicine?
I became interested in medicine since I was 17. I was in high school. I took a class in biology, like honors biology, and it was a synopsis of all of medical school in one year. And I was trying to figure out what to do. My mom was a dentist, and I didn't want to do dentistry. And so I really fell in love with it. And then I did pre-med and, did a year of research at Harvard. And then I kind of burnt out and went into retail for a little bit, went back to school and got my master's in physiology and went into medical school. I started medical school thinking I was going to become a psychiatrist because I really love to talk to patients. And I found out when I was in med school that I actually really liked primary care. I liked surgery. I liked pediatrics. And my fiance back then told me that, why don't you do family? And so that's how I got into family medicine. Since I was in med school, I always thought that there wasn't just one way of treating patients. And so what happened was, as I started my practice in California, I was in a big group, and I would often treat patients with kind of natural supplements if I could. And as time went on, I got interested in regeneration. So I started working with platelets when I was in private practice, on my own solo practice. And I had a friend of mine who was an orthopedic surgeon down in LA, and he told me about platelets. And later he told me that, stem cells work a lot better. So I went and did some research. And after about a year, I decided I wanted to do some, treatments with stem cells from patients' own bodies. And I went and got trained by Dr. Alexander up in Montana. He's one of the pioneers in stem cell treatments and stem cell therapy. And, I already had patients kind of lined up to do the procedures. And then I started doing them. The reason I really went to try to do stem cells is because I had a lot of chronic patients who had COPD, they had rheumatoid arthritis, and the specialists couldn't really offer them anything more than medicine. People had knee injuries, and they were kind of too young to get a total knee replacement, but they would go ahead and get these procedures and they wouldn't feel better. And I just thought there must be a better way of helping patients. So once I started reading about what stem cells do, I started doing them, and my patients had some great results. My initial patients being interviewed by one of the local TV stations. I think word of mouth, we did some advertising, and it started, people started coming. The thing that I liked the best is that I'm able to help patients using their own body's natural healing abilities. And that's what really inspired me to do this, because I didn't do it because of money. I did it because I had a lot of patients with chronic problems that I just felt, they shouldn't be getting some of the treatments that they're getting, like rheumatoid arthritis. They get Remicade. It exposes them to the possibility of getting cancer. In fact, I had one patient, older patient, who had, was diagnosed with rheumatoid arthritis later in her life, and she started doing Remicade treatments, which is an IV treatment that suppresses your immune system and at the same time decreases inflammation, but it also predisposes you to having cancer. So she actually wound up getting brain cancer and died like a couple of months later. And I just felt like, I just felt awful that, she got that treatment. Some people do well with them, but it's just a big risk. And when I started doing stem cell treatments on my patients who had rheumatoid arthritis, severe pain, and their pain went away, I thought, wow, this is great. Insurance doesn't cover it. It's an out-of-pocket expense. FDA doesn't recognize it as a treatment, but we've been doing this for years. They do it in Panama. You don't have to go to Panama to get the treatments, because I do the same thing. I do offer usually more than one treatment. It's all included when I do my therapy. So if I do joint injections, I usually wind up having them come back two other times to get more stem cells and more platelet injections into their joints, and it's helped. The thing that really sold me was that Dr. Alexander had done a study that showed that if there was a tear in a tendon, and he took a picture of that, an ultrasound of it, and then 2 months later, after the injection, the tendon was injected with stem cells, it started regenerating, and it showed on the ultrasound, and then a year later it was completely healed. And I thought, wow, that's amazing. So I started doing that. We took some pictures of our own patients, and we had similar results. Yeah, it's weird because I initially started doing it on, for autoimmune, like lupus, MS, and rheumatoid arthritis, and also joint injections for shoulders and for knees. But then my dad, he has Alzheimer's dementia, and his dementia got really bad. It progressed, very fast over a matter of like 6 months. And I thought, wonder if stem cells would work on him. And so I did a treatment for him. He was having maybe one-word responses to anything I would tell him or ask him. And he used to live with me, and that's all he was doing. And after the stem cell treatment, about 2 weeks after, he had a full conversation with my wife.
Wow.
And I thought, wow, that's amazing. So that's when
incredible.
I started doing that with patients who had strokes and a patient who had dementia. I had another patient that came in for an IV treatment. The IV treatments are also anti-aging treatments. And so what happens is that it kind of regenerates your body from the inside out. So any tissue or any cell that is aging is not working properly, they release these chemotactic factors that signal the local stem cells to come and try to regenerate the tissues. But as the tissues get older, the regenerative power of the local stem cells are not enough. So when I do the stem cells, I'm actually putting in a reservoir of stem cells that kind of home to areas that need regeneration. So this one patient that I was doing a treatment for, I think she had shoulder issues. And so we had injected her shoulders, and we also gave her an IV. 6 months later, when I saw her, she said, I used to have ulcerative colitis, but I don't have any symptoms anymore. And I thought, wow, that's interesting. And then she also said that she had macular degeneration, and that the last time she went to see the doctor, this was about 7 months after we did the procedure, her physician said that her macular degeneration, which was getting worse every year, had stopped getting worse. I treated my mother-in-law for her issues, and I had given her an IV. And she had early macular degeneration, and her macular degeneration resolved after about 3 months, because she went back to the ophthalmologist, and they told her that they probably made a mistake on the first exam, and she doesn't really have macular degeneration. Because of the fact that, there's no really reported cases in medical literature, that macular degeneration can actually be reversed. Mm-hmm. The ophthalmologist said, well, we were probably wrong the first time. And, they take pictures, so there's no way that they could be wrong. But I think that the few patients I did have initially that showed me, oh, okay, this can actually heal a lot of the aging processes that happen in the body. And, it was unheard of for me to see that macular degeneration can be reversed, because that's not how we're taught in medical school. So, so as time went on, I started treating more conditions, and just through my own clinical practice, I offer it for more things as more patients get better with their various issues. So I had one case, this is probably a year ago, patient came and sought me out, and she had studied, looked at stem cells, and she had something called mast cell activation syndrome, which means that her mast cells, which are the cells that are responsible for allergic reactions like hives and allergies, they get activated more than they should. So these patients, for example, if they get exposed to sunlight, their mast cells release all the histamine, they start having hives, they have difficulty breathing, their throat starts to close. And so a lot of these patients get treated with steroids. So they're getting steroids, and that's not good for the kidneys, it's not good for their immune system. So I told her, I said, I don't know if this is gonna work, but I will do it for you. So we did it, and her symptoms started to go away. And I think I did 2 or 3 treatments for her. And she called me, I think it was 6 months later. She says, you know what I'm doing now? I said, no, what? She said, I'm sunbathing. I said, really? She goes, yeah, I've never done that because I always get hives. I can't go under the sun. Mm-hmm. So now I'm treating patients who have that particular condition, which there isn't really any good treatments for. I mean, these patients are on loads of antihistamine, steroids. So it just, as time went on, it just seems like the stem cells kind of know what to do, and we just got to put it in the right place.
Yeah, I think that you touched on a lot of really good things in there, especially just all the cases that you've used this for, and just the incredible results that you're getting out of it. Now, stem cell medicine, regenerative medicine, it's a little bit of a newer area of medicine, and we kind of touched on this before as far as it's not FDA approved. There's a lot of regulation around it, or I guess they just don't look at it favorably. Do you think that the way that the government, the FDA looks at it, do you think there's any merit to their hesitation about it? Or do you think, what are your thoughts as far as regulation around it?
Yeah, personally, I don't think really, because, we're reintroducing patients' own stem cells into their own body. It's just that, if there was a pharmaceutical company, like there is one that does CAR therapy, they take the patient's, white blood cells, and they merge that white blood cell with a virus that makes the white blood cells supercharged, and then they reintroduce that. Now the cell is a little different than it was, but they reintroduce it into the body, and that in patients who have like leukemia, it cures them. Now they don't have a problem with that, because that company will charge the patient or the insurance company about anywhere between, I think, $250,000 to $350,000. Well, the FDA gets paid, so I think the FDA has a deference to drug companies. So this is anything that has to do with somebody using their own cells to treat themselves, even PRP, which are platelets, they kind of frown on that. Oh, this isn't really, we don't recommend this. Or for a while they were thinking, well, it may not be safe. The thing is that, stem cells have been done here in the States for several years, and they have several thousand patients that have received this, and they have safety studies that show that it's safe. But they just, it's much cheaper for an insurance company to pay a doctor a fraction of what they would pay for the IV treatments that a person with rheumatoid arthritis gets. They pay about $6,000 every 2 months for these patients to get these treatments. So we're looking at, like $36,000 a year that they're paying, whereas the stem cells is a fraction of that, and the patients are getting their own stem cells. And the patients that I treat that have rheumatoid arthritis, they have no pain for 5-6 years. The initial patients I did 5-6 years ago, they haven't come back for pain medicine for me. And they were in my office every month getting their pain meds because they were just in so much pain. Mm-hmm. and they haven't. I had one lady, I think we did her 4 years ago, and she had psoriatic arthritis. She was in a lot of pain. She was on Norco, and after we treated her, she has not come back for a prescription of painkillers from me, which was amazing.
Yeah.
And I did. So there's another patient who had celiac disease. Celiac is kind of like an autoimmune disease that the body starts to attack the gut from being exposed to gluten, to what's found in bread.
Mm-hmm.
And so I treated this patient. I told her, I said, it is anti-inflammatory. It's a very strong anti-inflammatory. I don't know how long it's going to help you, but it has helped patients who have these type of inflammatory conditions. And we treated her about, I think it was 3 years ago, and I haven't had to treat her celiac disease. Wow. She doesn't have abdominal pain anymore, and she's kind of good to go. So there's not as much research on this, because who's going to pay for it? So if it was a drug company, I mean, they'll pay for things that don't work and come up with results that show that they do work, and so they can sell their drugs. And then after a few years, we find out that there's some huge side effect that they omitted in their studies, or that it really doesn't work when physicians use it or patients use it. So I think that the FDA would want people to get treated with drugs rather than with their own, like with natural things, or with their own cells, So we do platelets for hair. I do platelets for face. We do stem cells for face to rejuvenate the skin, and they work. Studies they do in fact, there was a international study in San Diego, Stem Cell International. More than a study, it was a symposium. It was like a conference, and they had people from all over the world that do this in Germany, Panama, and all these scientists. These physicians would come up and they spoke and they said, what works, what doesn't work, and everyone had their own protocol that worked for different conditions, like cartilage tears, arthritis, back pain. I've had great results with back pain. I have patients that have spinal stenosis, chronic back pain, and we treat them with the stem cells, with their own stem cells, and they don't have pain after we inject them.
I think all the stories you've shared it's incredible. I mean, you have story after story after story, and I can see why patients travel from all over California to come to you for your treatments. So that kind of leads me to my next question is how do you approach educating your patients about these treatments? I'm sure that maybe some of them have heard about regenerative medicine. I'm guessing a lot have maybe heard the term but don't know what goes into it. So how do you approach that educational part where they maybe don't know what it is or have some idea but not a lot?
Yeah, so they'll hear about stem cells. They know that I do them. So a South Valley magazine called Enjoy Magazine wound up learning about what I did, I think in 2017, about a year after I started doing the procedure. And they interviewed me, so I talked to them about the stem cells, and I give my patients that. It's a kind of a synopsis of what the stem cells are, what they do. I've also, because so many of my patients have been interviewed every time we go to the TV station. Obviously, I go with them, so they ask me about what stem cells do. And in fact, I think I did a program on stem cells and how they work on that KC24. And I think we have some, if people search the internet under my name, Dr. Majzoubi, and stem cells, there should be a whole bunch of videos that we've uploaded just to kind of educate the public. And a lot of times what I'll do is I'll send one of my patients who asks me about it, video link, and then they kind of learn about it, themselves. And then if they have more questions, they can ask me. There are reviews of stem cells that talk about all the benefits of stem cells on a scientific basis. Sometimes I give them that if they're interested. It's not mainstream, but somehow many people find me.
Mm-hmm. So what are some common misconceptions then about this treatment that you provide? Because I'm sure you talked about education, but I'm sure you also get people who come in and think they know what it is, but they're not right. So could you talk about what are some of those common misconceptions that you often hear?
Yeah, so sometimes I used to hear it more often in the past than I do now. There are doctors who, I don't know if they're jealous or they just feel like, stem cell therapy is just not valid, or I don't know what the reasonings are, but there are doctors who kind of say negative things. And so, they're either on the internet, they say negative things. And some of the negative things they say is that, oh, it could cause tumors, it could cause cancer. And all of those have been debunked. It's not true. There is an enzyme activity that are checked for people who have, if we're going to test to see whether or not increase in the risk of cancer, if something is carcinogenic, for example. So when they've looked at the activity in the nucleus of these mesenchymal stem cells, they found no increase in risk of a malignancy potential. That's not the case with, in terms of tumors. That's not the case with, stem cells that are derived from fetuses. Fetal stem cells will produce tumors, but mesenchymal stem cells do not. So that's already been debunked. Some of these, falsehoods are spread by companies that are trying to sell stem cell therapy, some sort of stem cell therapy, and they want to not allow, give misinformation for patients about the safety of stem cells. But there's a company called the Cell Surgical Network that basically sued the FDA because the FDA wanted to ban stem cells in the United States because they said, we're altering the cells, which is not really true. And so they just won that case, I think in January of this year. So then people were just either January this year or last year. And so now we could do stem cells as long as it's given in the patient in the same day. So that was good. But I'm sure if there was any real evidence, they would have banned it. The misconceptions are just from what's out there in the internet, but I think most places they don't actually, there's so many people now that are looking for it. They're looking at sites that are more credible and talking to physicians who are actually, done this in the past and have had good success. Most patients that come in, they come in because one of their friends got treated by me, or they saw an interview with one of my patients on the internet, and that's how they seek me out. So, I mean, I'm not selling that. They're just the patients that have been interviewed. They share their experience with the audience, and that's how patients come to see me. I don't have any high-powered salespeople, unlike some places. There are some places that advertise stem cells. There are a bunch of chiropractors that get umbilical cord cells. They call them stem cells. They don't come from your own body. They definitely don't have the regenerative power of stem cells. The way stem cells work is you've got one cell that divides, and now this cell is, which is the stem cell, turns into another stem cell, but this cell is a specialized cell. So you have one stem cell, and then that stem cell divides into two cells, and one is the stem cell and this is the specialized cell. So the stem cells kind of start to just produce more and more and more specialized cells, and because those specialized cells have your own DNA, your body doesn't get rid of them. So umbilical cord stem cells, your body kind of gets rid of them after a few hours. So they do have some regenerative property, but in my opinion, it's a scam. So, and that's the problem is now you've got chiropractors who really have no business of doing stem cells on patients because they're not physicians. They hire some doctor that they pay, and the doctor injects the stem cells into, or the umbilical cells into the joints, and a lot of times it's not successful. I've had patients that come and seek me out after they've spent thousands of dollars on the procedure that didn't work, and they come to me and I do the procedure and it helps them. So you just have to sift through a lot of misinformation, a lot of fake stem cells in order to get the right physician. So if there's a physician that's doing it, you have to see how long they've been doing it. If they've just been doing it for a year, they're just doing it for money. They don't have good technique. if you have to find someone who's been doing it at least 5-6 years and just look at their track record, patients either online that have talked about it, or so sometimes it's hard to find, but most of the patients that come and see me, it's usually from word of mouth that have done other patients. And so.
Okay. Now, I want to ask you about your process. So when people think about medicine, they think that there's a process, there's a protocol, there's a step-by-step you have to follow. But what role do you believe creativity plays in how you approach patient care?
Oh, a lot. I think that you have to think outside the box. I mean, medicine is not what's in the medical books in my, behind me. The medicine is trying to find ways to heal the body or to treat the body in different ways. If the current treatment isn't working, that's how new treatments come about. Physicians experiment with, I'm not saying you experiment with your patients, but you use off-label medications or treatments to see if they work based on knowing how the physiology works and how the pathology works in disease. And if you feel that, wow, this should work because, for example, I treat patients who have anxiety with certain type of omega-3 fish oils. That's kind of out of the box, but it's natural. Most of the things that people take for anxiety either makes them too tired or they have other symptoms. They feel like they're too numb. And for patients that the omega-3 fish oil works, it's great because the mind still works well and they don't have any side effects. I think that when you go to med school does not encourage creativity at all. It's almost like you're in the military. You got to do what you're supposed to be doing. And I think that real medicine exists in a creative space. And that's how you find new treatments. That's how people make big leaps in medicine. I can tell you that there was a doctor years ago who was a gastroenterologist and found he was doing also research, and some of his patients, he was doing taking biopsies out of their, when he was doing endoscopies, and found that there's a bacteria that he first thought it was a contaminant, but then later, was convinced that this is the cause of ulcers. And, I was doing ulcer research myself, so I know like the whole landscape, and there were so many places that were doing ulcer research for years, 50 years. No one was able to find a cure. And here's this person that says, hey, I think I can cure this because this is an infection. It's not just, just an ulcer without any cause. And so he went and presented his findings in a scientific, symposium, and everyone laughed at him. And he was really upset. Then what he did was he says, you know what, I'm going to do this. So he took the bacteria, grew the bacteria, and then he told his friend who was a GI doctor, he says, why don't you do an endoscope and take pictures of my stomach that shows that I don't have anything. So he did that. Then he drank the bacteria and got an ulcer and had sequential, endoscopies that showed that, wow, there's a ulcer that's being produced. And then he took antibiotics, his own treatment, antibiotics and some antacids, and showed that with that treatment, the ulcer was gone. And then the next year, he went to the same symposium and presented these results. And this guy won the Nobel Prize for medicine.
Wow.
But my point is that, when people go against the grain of medicine that's been established, the medical establishment tries to do whatever they can to knock them down, because now they're things are at risk for them. So much, things were being produced for ulcers, all these companies producing all these things for ulcers. Now there's a cure for it. So now they're not going to need to chronically treat them. So same thing with stem cells. If stem cells can rheumatoid arthritis, and then no longer are they able to charge all this money, somebody gets a stem cell treatment once every 4 years, it costs like a fraction of what it would cost someone, the insurance company. And now you've got a financial risk for these big companies, and it's a risk for the FDA. They're like, well, if we can't get these, then what are we going to do? So then they hire these other doctors to poo-poo the treatments and say that this doesn't work and this isn't safe, and back and forth, and so that's how they spread misinformation. So I think that medicine doesn't like creative physicians.
Mm-hmm.
And so we're the ones that have to fight against, like, the establishment. And it's too bad, because creativity is what brings on innovation. Mm-hmm. And that's just not, that's not something that's encouraged in medicine. Yeah. Mm-hmm. So
well, I think that's
a long answer to your question.
It was very good. It's very illuminating, and I think you've been fighting the good fight and really trying to find solutions for people, not just a band-aid for them. So I think it's what you're embodying in medicine. I think is how it should be. Is that you're not afraid to go against the grain. You're looking for what are those solutions that's really going to help, and not afraid to try something different. So
yeah, I mean the people that are, so I can tell you, my wife's cousin, he's a psychiatrist in Canada, and he came up with a way to get people off opiates without them having any withdrawal symptoms in 24 hours. And so that was a game changer. But he had so much resistance from the establishment, because a lot of these big universities were getting money from the government to provide, they called it safe opiate use. So they were providing, instead of people going and shooting themselves with needles that might be contaminated, they said, we're gonna provide a safe environment for addicts. So they would come in and give them basically, narcotics, so that at least they won't get sick using bad narcotics. And so, he thought that that's kind of ridiculous. You're not really curing the problem. And I think when he came up with his method, it was, they really started coming after him, like, big time. And so he just recently, his methods were taken up by a lot of the Ivy League schools here in the country. I mean, he's toured Stanford, Harvard, Yale. They've asked him to come and give talks about his technique. And then in Canada, they were fighting him because they didn't want to lose millions of dollars from the government for the treatment that they proposed. So, they don't encourage, unless there's some drug company that comes up with something crazy, and can charge millions, thousands of dollars for a treatment. They don't really encourage innovation, unfortunately. But there's enough of us out there that disprove them with how effective the treatments are. And then the problem is, then a lot of patients don't really trust the medical establishment, because they feel that there are ulterior motives that are at play, not necessarily for the benefit of the patients. I mean, they say it's for the benefit of the patients, and to a certain extent, I agree with it, but they really go after things that are not, congruent with the medical grain of, we can treat chronic conditions with drugs, we can treat these with surgery, and that's it. There's no other way of going about it. And so there's, natural treatments and non-medicinal treatments are kind of not encouraged.
Well, I'm glad we have doctors like you, who is always trying to find better and better methods for people. So now, Dr. Majzoubi, I do have one last question for you, but before I ask it, I want to point people to your website at www.medicalclinicvisalia.com. Now, last question is, where do you think the future of regenerative medicine is going? I know we talked a lot about it so far, but where do you think the future of it's going?
Where do I think the future of stem cell therapy is going, regenerative medicine?
Yeah.
I think that in the next few years, there's going to be more and more studies will be done on the effectiveness of stem cell treatments. We still don't know a lot about it, because I'll tell you why. When I do stem cell treatments, there's something called the stromal vascular cells. That means that all the cells that support the stem cells. So you've got fibroblasts, you have endothelial cells, you have pericytes, which are precursor stem cells, and then you have stem cells. I also have a company that I use for people who want to get just harvest their stem cells and have it banked somewhere, and just whenever they need it, we can just call them and they produce more stem cells. Those treatments don't work as well as the one that I do in my office, because it's just that stem cells, those stem cells. It doesn't have those supporting cells with them. And those supporting cells are really important in regeneration. So I think that the direction is going to go towards, as we find what is exactly the role of all of these cells, rather than just having a smorgasbord of like all these cells together, which we know works. What combination works better and what percentage of stem cells work better, that's what we don't really know yet. I think once we get that under control, or we're able to elucidate that, then I think it's going to be more mainstream. But I think that in reality, what's going to happen is people are just going to seek this more and more. And we're going to have people, doctors that show through case study after case study that certain things work better. Certain treatments are treated just as well as medication. And I think we're just very close to that, because there's enough of us that are doing these patients that now we're able to just have case studies that will show. And then those case studies, I think, would open up research. That the research that really needs to be done are not research that's going to be done by, pharmaceutical companies, because they're not going to make any money out of this. The research is going to have to be done by, universities and medical schools that will do research. And that research has to be funded by the NIH. And if NIH money for stem cells isn't increased, then we're just going to have physicians that are going to just show. So I think that we're at an impasse, that whether the medical community is going to at some point recognize that this is important research that needs to be done. And we need to really be able to focus on how our body can help ourselves. So I think we're in a kind of a nomad's land right now in terms of what direction it's going to go to. I know that within the past 4 years of me doing this, well, I've done it for several years, but the last 3 years, now people are coming and seeking me out because they've already done their research. And I think as more and more clinics in Europe start to do this, that eventually the medical community is going to have to accept that this is actually a legitimate treatment for chronic conditions. That's going to be a lot cheaper.
Got it. Okay, well, there you have it. Dr. Majzoubi sharing his expertise. Now, Dr. Majzoubi, where can people contact you in your practice? They
can contact us through calling us at our phone number 559-740-7989. They can also follow us on Facebook and Instagram at Maj Medical Clinic. And they can also email us at majmedicalclinic.com, majmedicalclinic.com. We're located in Visalia, 5109 West Goshen Avenue, Visalia, California, 93291. And we're between Fresno and Bakersfield in the Central Valley.
Awesome. Well, thank you for being on the show, Dr. Majzoubi, and sharing your
message. Thank you. Thank you for having me.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.